cancer is the number one cause of death in South Korea. But this can be treated by controlling living habit and taking early detection. Now we're gonna go into more details on cancer.
안녕하세요. 지식 큐레이터 김소영입니다. 유방암은 갑상선암에 이어 여성 암 발병률 2위를 차지하고 있는데요. 조기에 발견할 경우 치료 결과가 좋은데요. 무엇보다 잘 아는 것이 중요하겠죠. 오늘 이 시간에는 유방암은 무엇인지 원인과 증상, 치료 후 관리법까지 자세하게 알아보도록 하겠습니다.
The westernization of Korean life is driving the increase in the number of cancer patients. So the breast cancer is one of the most popular in South Korea. Mostly breast cancer occurs from women who has no risk factors. Risk factors from 20-30% of breast cancer patients are pretty diverse. And actually more affected age of breast cancer is 40 to 50 years old. On the contrary, breast cancer is mostly found in ages 30 in South Korea. Therefore, even if young women need to pay special attention to it, breast cancer incidence rate is higher though. There is actually high chances of survival. If cancers are detected early with aggressive treatments, it's gonna be possible to overcome it. One of the most common symptoms in patients visiting medical center is getting lump in the breast with no pain. But a couple of patients may have pretty different types of symptoms. In some cases, people may not have signs and symptoms in the early stage of breast cancer. Breast pain found in female is not involved in breast cancer mostly. But if you notice changes in your breast, you need to contact your breast physician. To check abnormalities, you need to take periodical breast examination according to your age. You are advised to consult a physician, especially if you are in cases of high risk of breast cancer. Breast examination is taken based on mammogram and ultrasound. If the mammogram shows an abnormal area of the breast, cancer detection is taken by this exam. You can take the biopsy procedure to check the presence of cancer. What if you need to take more specific diagnostic workup? Your doctor is going to order additional tests, such as MRI, bone test, or a CT scan, to verify metastasis of cancer through your whole body. Breast cancer can be divided into 5 different stages in number 0 to 4. The stages are determined by the size of the tumor, the number of lymph nodes affected, and the degree of invasion of cancer in the surrounding organs. The stage tells us how aggressive a tumor is. That's why it's really important to determine its treatment. Surgery is considered the essential treatment for breast cancer. The goals are actually to complete the resection of primary tumor, not only recover the primary function, but also keep the quality of life. Breast is actually one of the symbolic parts as in femininity. So after eradication of the whole breast called mastectomy, a couple of women experience a deep sense of loss or depression in terms of their body image. In recent years, partial mastectomy is actively used to treat breast cancer, including radiation treatment. In addition, sentinel lymph node procedure is actively used for the first time. When the stage is determined after breast cancer surgery, a patient with breast cancer needs a various type of adjuvant therapy. This treatment is really important because the patients at higher risk of cancer recurrence are more likely to need an adjuvant therapy. Radiation therapy is one of the cancer treatment utilizing radiation. This radiation kills cancer cells by damaging their DNA, which is indispensable for cell proliferation and their survival as well. What if you have taken partial mastectomy before, or have severe lymph node metastasis after the operation? You will have radiation treatment. This treatment requires 5 to 7 weeks. It takes about 10 to 20 minutes, 5 times a week. Generally, breast cancer and its treatment make little complications so people can be restored to health. But there might be some side effects of having, such as a little skin changes, temporary pain, itching, uncomfortable, fatigue, and lymph nodes on spot exposed to radiation. Chemotherapy is a treatment method that uses a combination of drugs to either destroy cancer cells or slow down the growth of cancer cells. They are divided into post-operative adjuvant chemotherapy, pre-operative adjuvant chemotherapy, and palliative chemotherapy according to each purpose. Recent years, personalized treatment can be possible to block the signal targeting substance affected in cancer generation process. One of the representative genes called HER2 is known as the gene represented on 20-25% in total breast cancer patients. We're looking for to increase the treatment's effectiveness with little side effects by utilizing drugs separately or using it with anti-cancer drugs. Estrogens, produced by the ovaries, are one of the essential hormones for normal growth and development. But this also affects the generation and progress of breast cancer. Therefore, anti-hormonal therapy is defined as reducing the estrogen effecting on recurrence and metastasis of breast cancer. This is one of the total care treatments and prevention, including chemotherapy. A couple of representative side effects are menopausal symptom and arthralgia, but most patients adapt to those symptoms. After primary treatment for breast cancer, regular tracking examination is pretty important because this process is detecting the distant organ metastasis early or cancer on the other breast. Breast reconstruction is a type of surgery for female who have had the entire or part of a breast removed. The surgery rebuilds the breast mound to match the size and shape of the other breast. The operation methods are divided into 2 different types. The first one is called immediate type breast reconstruction, and the second one is delayed type breast reconstruction. Breast reconstruction utilizes such as breast implants or autologous tissues, and this process can be chosen after consulting with patients regarding various factors. Adding nipples and the dark area around the nipples after building the breast, the process of breast reconstruction is successfully completed.
삼성서울병원 유방암센터는 최신 치료 지침에 따라 표준적인 진료와 맞춤 치료를 시행하고 있습니다. 각 분야 전문가들이 함께 모여 협의하는 다학제 협진, 특히 40세 이하의 환자를 대상으로 하는 젊은 유방암 다학제 클리닉, 유전성 유방암 클리닉, 유방암 평생 클리닉 등 특성화된 클리닉을 운영하고 있습니다. 저희 삼성서울병원 유방암센터는 유방암의 조기 진단과 적극적인 치료를 통해 유방암 환자의 생존율을 늘리고 삶의 질을 향상시키는 데 최선을 다하겠습니다.
네, 지금까지 유방암에 대해서 알아봤습니다. 오늘 제공해드린 정보로 질환을 이겨내시는 데 큰 도움이 되시길 바라겠습니다. 고맙습니다.